Good day! I am Dr. Wilfredo S. Tagle, Urologist. Welcome to Medical PracTIPS. It is a series of tips and tricks to help you improve your medical practice. For today's episode, we will be talking about medical consultations etiquette. What do you do in your clinics? How do you encounter with your patients? The most important foundation in every doctor-patient relationship is communication. During the first few seconds your patients meet with you, they are already forming their first impressions of you. It is your job to communicate effectively with your patient so that they can form a good impression and know that they can trust you. Yun ang importante. Yeah. As soon as the patient walks in, the first thing to do is to greet them properly and address them with a smile. As much as possible, you call their name from family name, first name, and middle name. If they have some apex like junior or a senior, then their position like MD, attorney, engineer, so that they will feel great. While doing this, maintain a good eye contact and focus your attention to your patient. Okay. Make them feel that you are listening to your care and you empathize with them. Always start with the question, why did you visit our clinic? And let them explain what happened. Siyempre, just like in our medical school, you always start with the chief complaint. Use an open-ended questions. What happened? When did it start? What are the associated signs and symptoms? Medicine is not black and white. It is always gray. Remember that patients' histories are stories of their experiences, not just a question and answer. Hindi siya dikahon. While they tell their stories, don't overlook any other problems. Always avoid making it seems like their problems are trivial. Let them feel that it is a common problem and you have already experienced it with other patients. Additionally, avoid any distractions like cell phones, computers, and alikes. Then, this will help foster compassion and empathy to your patients during your conversation. Patients may stay away from the main focus. For example, they will start with flank pains because they have started eating and later on they have experienced it way back since childhood. It is your job to help redirect the story of your patient to the main problem. Okay. After getting all the facts, signs, and symptoms, it is now time for you to form your impression. Doing a simple PE will also improve your positivity of having a good impression. Explain to the patient how you come up with your impression. As much as possible, do it in a vernacular way. Okay, don't use any medical jargons. Remember that not everyone would understand all medical terms. Try to imagine that you are talking to a family member or to a friend who does not understand any of these medical terms. Use drawings, posters, and models like this to show to them so they would understand more. They could picture out what is happening in their body. Once you have the impression, give your plans, your recommendations, medications, options. Discuss this with your patient and always include the family or their relatives. Always give them the chance to decide what course of action to take next. Give option 1, option 2, option 3 as much as possible, and let their patient and their relatives decide what is the best for you. Once you have and your patients have agreed on the plan of action, be sure to give instructions, what will happen, what to expect, and always give a home care, what to do in their house. Give your patient a chance any clarificatory questions so that you will know that they understand what you are talking and you are at the same wavelength. Have to ensure that patients fully understand her condition, his or her condition, the plans of actions, and the overall situation that they are into. Lastly, try to end your conversation on a positive note. Always give a hope for your patients. Give your patients words of encouragement. Let them know that they can contact you if ever they feel something different or they have more problems. And let them feel that you are with them all the way. So, that's it for today's episode. Tune in every Wednesday, 7 p.m., the latest episode of Medical PracTIPS. Okay? See you! Bye-bye!